Recently, I watched a video of Americans who live in Canada talking about their experience with the Canadian healthcare system, how it compares to America, how sadly they feel like they can't actually go back to America because they've got illnesses and that it would just be too expensive. That kind of just broke my heart. Just such a sad thing that America has that sort of system where people go into real financial difficulty just if they get sick, man. Like, it's something you shouldn't really have to deal with, especially in a sort of developed country, but they do. So I've seen this video come up on my recommended side by side. How do the US and Canadian healthcare systems compare? Just wanted to see more in more detail how they actually compare. But tell me, your experience if you've had to be part of either of them, like how they compare if you know, but just tell me more about the Canadian healthcare system and your experience with it.
Healthcare consistently polls as one of the top issues for American voters going into the 2020 election. A lot of people who aren't happy with the American healthcare system seem to think we should adopt the Canadian way. Others say Canada's system isn't as good as it sounds. Tonight, we're going to look at the basics of both systems. America and Canada, allies in politics, rivals in sports. We've got a lot of things in common. We both speak English for one, though they're pretty good at French too. We both love Celine Dion and Garth Brooks. There are some differences, however. Baseball, that's our national pastime. Theirs is hockey. They also like the metric system. We still use the king's foot for our measurements, but no subject whatsoever gets more attention when drawing discrepancies between the two North American neighbors, like healthcare. In America, liberals tend to lionize the Canadian system. Conservatives pan it. So what are the facts?
Didn't know that.
First, the histories. The U.S. healthcare system sprung up mostly during the Industrial Revolution. Factories were dangerous, and emerging unions fought to have employers pay for injuries and illnesses workers got on the job. In Canada, this guy, Tommy Douglas, developed their single-payer system in the 1960s. Some polls say he's more popular in Canada than Wayne Gretzky.
Is that true? Tell me, I feel like I've heard the name maybe on a previous video. I don't know really anything about him, but is he highly regarded in Canada still to this day? Is he well known?
Canadians pay taxes for their health care, and each province or territory provides medically necessary services with that money. But here's a catch. Each province or territory gets to decide what medically necessary means.
Oh, so is there differences between the provinces themselves? Does that lead to different levels of how the healthcare system is in each of these provinces? Or is there any provinces that are known for, or any province that's known for having a better healthcare system than another? Any that are worse than any others? Tell me how it is in your province. Are you happy with it?
There are a lot of different estimates, but Consumers Mutual says the average Canadian pays about $160 per month in taxes for that basic coverage, or about $2,000 a year.
Tell me what you think about that. I don't know when this video was made, if that's changed since then, if that's an accurate figure. I guess it would be if it's on this show, but how do you feel about that? I feel like that's a reasonable amount to just have that peace of mind. And yeah, how does that, when you go to the hospital or when you go for any sort of any work or any checkup, if you need to use the healthcare system, do you have to pay any further amounts for anything?
Private healthcare still does exist north of the border, but as a supplemental option, and a lot of Canadians do buy that. In the United States, our employer-based...
Yeah, and with that as well, tell me if you do buy private, and if so, why? Is it just to get seen quicker? Do you get that much of a better level of care with private in Canada?
Our employer-based system varies wildly. We pay premiums every month, and if we need to actually access health care, most of us have to pay hundreds or thousands out of pocket before that coverage ever kicks in. eHealthInsurance.com says the average deductible for individual plans is $4,358, $7,983 for a family plan.
And that's the thing, I've seen figures in America, the average amount of savings people have, especially today when people are just really in bad places, it's very, very low. So even though for some people that might not seem a lot, for some people, for some families and some single people, That could be quite devastating, actually.
Let's say your premium is $200 a month. For a family, you are closing in on $10,000 a year before you see any coverage. And that's just what workers pay. On average, U.S. employers pay more than $13,000 per employee. Okay, consequences of the cost. An article in the American Journal of Public Health shows more than 2/3 of all bankruptcies are because people cannot pay their medical bills.
Yeah, man, I've seen that before.
Canada
Crazy.
does still have that problem too, but to a much lesser degree. 15% of people 55 and older who file for bankruptcy in Canada do it because of medical costs. And like in Canada,
Still
most lifetime
relatively
caps
high.
are prohibited by U.S. plans. But before Obamacare, as an example, if you had cancer, they may have stopped paying for your treatment once you hit $1 million. A big thing people talk about with Canadian healthcare is the wait time. And yes, some estimates say it could take 22 weeks to see a specialist after your primary doctor makes a referral. Even just getting an MRI could take a month. In the U.S., it's between 18 and 22 days to see a specialist.
Whoa, okay, that's like a big discrepancy. Like, obviously that one's in favour of the US, but is that normal? Like, I guess that's why most people take private, so they can maybe get seen quicker, but 22 weeks? That's a huge amount of time. How do you feel about that? Have you ever had to wait that long? I guess people's health could really deteriorate quite quickly in that time as well, or like quite a bad way, man. Whoa, I didn't realise it was so long.
In both countries, healthcare costs are rising, but there are a lot of factors that go into that. Popularity for each system also drastically different. In the United States, a Gallup poll shows our healthcare system has an approval at around 38%. In Canada, surveys regularly show approval for the healthcare system is in the 80s. And a recent Nanos poll showed 60% of Canadians are willing to pay even more in taxes for expanded coverage. There are tons of other aspects we don't have time to look into, like prescription drugs and the arguments some make over quality of care. But these are some of the basic numbers and facts that we could dig up when comparing the United States and Canadian healthcare system.
Yeah. So, yeah, that one again, like the quality of care is quite important, but again, how do you measure that? It's just people's opinion. Tell me what you think about the quality of the healthcare system in Canada, in your opinion as well, if you've had that experience as well. But yeah, interesting to have a look at both of them. I didn't realise it was such a long waiting time for so many things in Canada. But yeah, obviously just having that peace of mind about the cost is quite important as well. So yeah, tell me what you think about this video. Thanks.